Hi guys, it's JB here, and in this video we are going to talk about sickle cell disease, also called sickle cell anemia. So what is it? It is when the RBC or red blood cell gets sick and the shape becomes sickle. You could also think of it as a banana shape. So in this diagram right here, the left side is a normal red blood cell, and on the right side is a sickled cell. A healthy red blood cell carries hemoglobin, and hemoglobin carries oxygen. Oxygen is the one that keeps you alive, keeps you breathing, but what if it's cut in half? That just means that the patient will always be short of breath, right? There's not a lot of oxygen going on in the body because let's say that the red blood cell is cut in half. A healthy red blood cell can live up to 90 to 120 days. Once it is cut in half, what's going to happen? Is the red blood cell going to be living for 45 days now? No. The right answer would be 10 to 20 days. So if you have a sickled cell patient and they're asking you how long does the red blood cell can live, it'll be 10 to 20 days. What else do we need to know about sickle cell disease? It is an inherited disease and it has no cure. So the patient will be having this for life. And patient with sickle cell anemia will generally do not live past 50. So the next question will be, why is it forming into a sickle shape? It is because of genetic abnormality, and I know this is very broad, but I got you guys' back because I'm going to show you an animation of a very good detailed explanation of why it is forming into a sickle shape, and I will leave the link in the descriptions below, okay? So make sure to check that out. So the next question will be, who is at risk? It will be family history of sickle cell disease. Now, what are the signs and symptoms? It'll be intense pain, acute pain, chronic pain, and when it comes to assessing pain, we want to know where it is, how strong it is, and how long does it last. Another sign will be necrotic tissue. Necrotic basically means that the tissue is dead, it's dark. And the reason why I said that, because see these little red dots right here? They're all healthy, normal red blood cells. They're just bouncing around the vessel, doing their own thing, they're going through smoothly, and then they see a constriction right here. What's going to happen is they're gonna go around it, bounce around. This area here will have a little bit of trouble with oxygen, but they'll get through. Now if the patient has a sickle red blood cell, they're going to be stuck here. They're not gonna bounce around because they're shaped like a banana, and they won't be able to bounce around going through the flow and leading to blockage. So there will be no oxygen going through this area. That could lead to hypoxia, and then it'll start inflaming because they're like, hey, we need oxygen, come give us some oxygen. And then when it's inflamed, that will cause edema or swelling of the lower extremities. If this is not prevented, that could cause a necrotic tissue. Like I said earlier, it's a black tissue that's dead. Also, we need to know that patients with sickle cell anemia will always be tired because of shortness of breath, and they will always be prone to infection, and a good sign will be fever. Now let's talk about the intervention. We want to educate the patient or the parents to have a single provider for pain management. We also want to educate them to wear protective gears when playing around. Just remember that their life is not over. They can still do whatever they want with caution. Tell them not to do physical sport exercise. They could, swim or biking. Just don't get into contact sports. Also, we want to educate the parent not to restrain the child. What I meant by this is when the patient is getting an injection, the parent will think that they had to hold the child because the child is refusing the treatment or the injection. So they are going to be holding that child to stop them from moving. No, they shouldn't be doing that. We want them to provide encouragement. Tell them you can do this. This will help you get better. Just relax, breathe, and it will be done before you know it. We also want to refer them to support groups so that they could relate to patients that has the same disease. Also, when it comes to pain assessment, we want to use the Baker Face Pain Scale. I drew this little ugly thing right here because their picture was saying copyright infringement and you need permission. So I'm like, okay, I'll just draw it. So 0 will be no pain, 3 will be it hurts a little, 5 would be it hurts, 8 will be it hurts a lot, and 10 will be it hurts so much. Please do something. Another type of intervention would be distraction for pain. We could use TV or music to distract them. We could also use toys or blankets so they could feel secure. And we could also give around the clock medication as needed. The nurse should avoid use of any medical terms, and we could also tell them to complete their vaccinations. Now let's talk about treatment. Treatment will be multiple pain management or multiple approach to maintain the patient's quality of life because they're always in pain. They just want it to stop. So we're going to use multiple approach to treat the pain. We could use TENS unit. I use this. This is really good. We could tell them to do physical therapy. Massage is also good. And I put blood transfusion because sickle cell shape could only live for 10 to 20 days. If they don't have enough blood going through around the area, we want to do a blood transfusion. Also, we could use medication, which would be IV fluids, oxygen therapy, opioid. It is for moderate to severe pain. An example will be morphine. And before you even give morphine, make sure to get the respiratory rate first because morphine is a CNS depression. And if the patient respiratory rate is less than 12, we do not give the morphine. Another one will be NSAIDs. NSAIDs is an anti-inflammatory medication. It is for mild to moderate pain. An example is aspirin. And one thing we need to watch out for NSAIDs is that its chronic use could lead to GI bleed. Another type of medication will be topical analgesic. It is called lidocaine. It is basically to numb the patient's skin when you want to give any injections. An anticoagulant could be used, which would be warfarin and heparin. One thing we need to watch out for this two right here is that bleeding, because they treat blood clots. So blood could just go through around the body, and that's what they're doing. So we need to watch out for bleeding. Another type of medication will be antibiotics. Penicillin is recommended for patients that is 2 months to 5 years old. And lastly will be complication. I put clotting here because the sickle-shaped cell will just get stuck with each other. They're not bouncing around like the normal red blood cell. They get stuck and form a occlusion of the vessels. An occlusion of the vessels could lead to sickle cell crisis, and it could get worse because they are also at risk for stroke. And the last one will be bleeding. I have put bleeding because if we're giving the patients warfarin and heparin, they might be at risk for bleeding. Thank you very much for watching. This will be the end of the topic for sickle cell anemia or sickle cell disease. And if you guys have any questions or something to add, please leave it in the comment below. And my next topic will be renal calculi.